In this short video, we want to have a look at ankle and foot pain, specifically when running. So during lockdown, a lot of us have started to run either a lot more or started to run having never ran before. And we might be experiencing foot or ankle pain, or we might have had to stop running because of foot and ankle pain. We want to talk to you why this might be happening, the muscles involved, the anatomy involved, and why you shouldn't stop running because of ankle and foot pain and how we can help. So during lockdown, we haven't been able to treat people, but we have been offering online consultations, and this has been the single biggest thing that people are asking for our advice on. So hopefully this video will help people understand why our ankles are getting sore and how we can prevent that. Anyone in the fitness industry knows that there's no quick fixes, so this isn't going to be an instant fix. It's definitely something that you have to work on and allow your body time to condition and become strong for running. I do have a S&C video for running and an ankle stability work video as well. I'll link those at the end of this video. This is going to be more about understanding why our ankles hurt, so hopefully helping a little bit psychologically with that. The muscles we want to talk about, obviously everyone knows the calf muscle, the gastrocnemius and the soleus. Yes, they're important, but we're not going to focus on those in this video. And we also have the tibialis anterior, which is quite a major muscle. The ones we're going to focus on are the smaller muscles that cause ankle and particularly foot pain. So we have all muscles work in pairs, so we have muscles at the front and we have muscles at the back. The muscles at the front are the extensor muscles. These, again, they start at the bottom of the shin and they run across the ankle and into the foot and the toes. These muscles work to dorsiflex the foot on the ankle, so the motion of bringing our foot back up towards us, and they also work on extending the toes, so stretching the toes or sort of pointing the toes back towards us. Even just by doing that motion, you'll be able to feel where the muscles start to work. So as you can see across my ankle here, the muscles and those tendons start to pull as I extend my toes and also as I dorsiflex my ankle. The next set of muscles are the peroneus muscles. So these are at the back of the calf, and they're a little bit lower down. So we have peroneus longus, which starts up and around here, peroneus brevis, which is a little bit lower, and then peroneus tertius, which runs across, and then the tendon for this runs along the outside of the foot. A lot of people have been asking about outside foot pain, and it's a lot of it is peroneal tendonitis, and it's just an inflammation of that tendon because all of a sudden it's been asked to do a lot of work. The peroneal muscles work in the opposite plane, so where extensors do dorsiflexion, the peroneals do plantarflexion, so the act of pointing our toes or extending our ankle. They also work to invert and to evert the foot. So the sole of the foot is just pointing it away or towards the center line of the body. This is a really, really important movement for the ankle. So imagine when especially if you're on uneven surfaces, we just want to allow a little bit of roll in our foot. So the first thing to do and the first way to mobilize and start to use those muscles is just to do that motion. So we want to dorsiflex and extend our toes. We want to plantarflex and point our toes, and we want to invert and we want to evert our foot. So we can do both at the same time. You can use a band just to extend specifically the dorsiflexion. So if you band around your foot, and then you can just pull back on the band just to increase that amount of dorsiflexion, so active range of motion, just to increase the movement there. The reason that we get pain across these muscles is because we don't tend to use them too much. So we don't often invert and evert our feet, and we don't often go through full dorsiflexion and plantarflexion. One of the best ways to do this is to think about how we walk. So most people nowadays, because we wear trainers and footwear quite a lot, we're not too aware of how we're walking. Normal motion of walking nowadays is for our foot to be quite lazy. So if you watch what my foot does just in a normal walking motion, there's not too much movement of the ankle, so not too much dorsiflexion, plantarflexion, and we're not using our toes too much. So what I want you to think about next time you're walking, or if you're doing this at home as rehab, is really focus on what is your foot doing. So ideally, you should allow your foot to relax into the floor, preload all of the tendons in the foot and the ankle, and then allow for a really nice bit of plantarflexion and extending of the toes, and then you should feel you should almost get like a nice little spring and a push up with that. This is very exaggerated, but the more you work on it, the better these muscles will become. They become more elastic and more resistant to fatigue as well. So land with your foot and then really exaggerate the pushing off with the toes. That's how it's designed to be. That's why long toes is seen to be a good thing, because it gives us more of a spring. So really focus on that when we walk. You really want to focus on getting the sole of your foot to point back up and really use your ankle and your foot as it's designed to be. So again, most people, if you're following people walk, you don't see the sole of their foot because they're not pushing off properly. Proper walking gait, you should see the sole of the foot as we're using the entire foot the way it's designed to be. It's a really, really simple thing, but it's a really good way to fix or correct ankle and foot pain. So give that a go. First time you do it, make sure you're either wearing your socks or your barefoot, because you'll really be able to feel the foot working and the ankle working, especially the perineal muscles around the back. You'll be able to feel them just start to stretch out and spring. There's all sorts of things you can do for this, so things like heel drops. So if you have a little bit of a side, you can do heel drops where you're going all the way down and pushing back up. And again, we're just getting used to those muscles to rebound a little bit of energy. You can do that flat on the floor. You can do it one leg. So you just want to be bouncing up and down. You can do little pushbacks onto your ankle and as you push off. And again, a lot of these are in my ankle rehab video, which I will link at the end. All we're trying to do is just get our bodies used to using these muscles. So if you imagine the first time you go back to the gym after lockdown, if you go and do an arm session or a chest session, next day you're going to feel really sore. Effectively, that's the same thing that's happening with your ankle. So it might be that the tendons are getting a little bit sore and a little bit inflamed, and that's what's causing your pain. So not much of what the pain you'll be feeling is long-term pain. So do stick with it. Make sure you're really mobilizing your ankle. Make sure you're trying to get a nice bit of resistance to fatigue or endurance training into those muscles. But please, please, please don't think running is bad for me. My ankles are really sore, so I'm going to stop. Good pair of trainers. Make sure you're buying a new pair of trainers every so often. If you're running in old shoes, they lose their bounce and their flex in the resistance to fatigue again. So new pair of trainers, and really, really do try and strengthen and condition your ankles, all of the muscles we talked about for running. If you want any more advice that's not in this video, or you are struggling with foot pain yourself, please do get in touch. We are hopefully coming close to a date where we can reopen and treat you in person, but until then we're more than happy to give you some advice either on the phone or just drop us a text. Check out the website, which I'll link in the comments to this video. Thank you for watching. I hope that helps you understand and hopefully psychologically deal with ankle and foot pain a little bit better. And please be patient with it, stick with it, because your body will become stronger and better at running and pain-free as well. Thanks for watching. See you soon.